Hello, everybody. Do let me know if you can hear me. So if in the comments section, if you type yes, we are able to hear, then I know the technology is working. Are you able to hear me? Okay, fantastic. Say, yeah, okay, great. Let me just wait for, let's say, a minute or so. So there are probably other people joining, and we can get going. Yeah, in London, it's been a bit of a gloomy weather. We have had great weather, like we had real good temperature, sunshine. But this week, I think, yeah, it's a bit gloomy. Okay, so I'm just going to wait for a minute or so. I can see Dr. Saurabh, Hita, hello. Hello, Vinod, and Dr. Narayan. Hello, Amandeep. There are more people joining. Hello, Srijit. Hello, Saubhagya. Hello, Sriram. So it must be evening for those who are watching from India. Hello, Narasa Reddy. Hello, Vijay. Oh, that's the same as my name. Dr. Sapna, Dr. Vikrant, Rekha. Okay, so let's get going. And, those who are going to join us a bit later, I'm sure, they'll catch up. So this is going to be quite an open structure in the sense, please do ask questions, or if you have any comments, please do place your comments, and I'll try and read through the comments, and should there be an opportunity, I will definitely respond to you. So the topic that Dr. Narayan, who is the organizer of this Tadvidya Sambhasha Parishat, asked me to talk about is career pathways for Ayurvedic graduates in the West, opportunities and challenges. It is certainly a topic that I can say I can speak with experience because I have had opportunities and challenges both since I completed my BAMS and then later my MS in Shalya Tantra. I completed my BAMS in 1995 and MS in 1999, both from Bangalore, Government Ayurvedic Medical College, Bangalore. Obviously, my career in Ayurveda outside of India started after that. And since then, I have lived in different countries. New Zealand, where I was head of faculty for Ayurveda at a very large, in fact, one of the largest natural therapist colleges in New Zealand, Park College of Natural Therapists. That's where I learned a lot to become an educator, to become a teacher, to train my students to practice in the West using Ayurveda. And then I've been an academic and research head for the same college for some time. And then I moved to Australia, where I did my PhD. My PhD is not in Ayurveda. My PhD is related to complementary and integrative medicine, but it's a health services research. I hope during this live session, I will be able to talk to you about how you can either choose a clinical or practice path, or you could focus on academic pathways. See, because I have had both these opportunities, I understand the possibilities and also the challenges of these two, and this might actually help many of you if you are particularly graduating and you are looking for a career outside of India for Ayurveda. So I obviously, because one, I like learning, and also it was necessary for me to understand the Western health environment, the Western health policies, basically also the needs of people who seek Ayurveda in the West, or in general people who benefit from Ayurveda in the West, for me to be able to upskill. Therefore, I studied a bachelor in naturopathy, Western naturopathy. This is not the naturopathy of India. This is more the Western herbal traditions, Western naturopathy. I did a bachelor's in New Zealand, and I then did a master's in public health from the University of Auckland. And I must say that really excited me, because it really gave me that opportunity to utilize my research skills, or even actually learn more advanced research skills to see how Ayurveda can play a role within the healthcare system. I'll talk to you a little bit later about that exciting journey, and possibly you could be part of one such exciting journey if you want to. And I also did a PhD in Australia at the University of Newcastle in Australia, not the Newcastle here in England. And then I completed my PhD from the University of Technology, Sydney, in Sydney, obviously. And I took a health services research approach. I have published papers. I'm happy to share the links of my research papers, because it might actually interest some of you if you're looking at research career. I'm also going to, at the end of this live session, give links to my website. If you already are able to take notes, then you can go and look at www.murthyclinic.com. Murthy, which is my last name, Murth, clinic, as in clinic.com. Or you can have a look also at ayurvave.com, which is AYUWAVE.com. So there is no R, okay? Some people think it's Ayurvave. No, it's ayurvave.com. And later I'll give you a link to my Google Scholar profile, so you can have a look at the various research that I have done in Australia and also in Germany. So with that brief introduction, I hope it wasn't brief, obviously. I will start to kind of share with you what you would need to consider. Okay. I have to be very honest with you that there is a difference between looking for a job, looking for a career. When you are looking for a job, which is what many times I get this inquiries from my Indian colleagues and friends saying, "Oh, is there any job opportunity for Ayurvedic graduates in the West?" Well, job is different. Career is something that you build. Career is something that you build out of your passion and your skills. Job is rare in the West. For somebody getting a job because of their Ayurvedic degrees is very rare. But if you want to build a career, yes, that's possible. Let's talk about the legalities of it. So let's start with the very first question that most of us ask: is BAMS recognized? BAMS, Bachelor of Ayurvedic Medicine and Surgery, whether that is recognized. Is our MD or MS is recognized in the West? There is a difference between recognizing education and recognizing licenses to practice. Yes, be assured that BAMS is recognized as a bachelor levels education in a health field. When you apply for your educational evaluation, should that be necessary, when you send your transcripts and mark sheets and certificates to, I did it with the New Zealand Qualifications Authority when I first moved to the New Zealand. I had to do that. And they came up with my BMS MS, they came up with saying that, okay, I have a postgraduate degree in Ayurveda, which is health field, but cannot be compared to any other medical qualifications which are existing in New Zealand. So this is important to understand, that your qualifications, your level of education is always recognized. That give you the opportunity to practice, that's a slightly different thing. So the opportunity to practice Ayurveda, or the eligibility to practice Ayurveda, I must say, in, let's say, UK or New Zealand or Australia. So these are the three main countries that I have had experience with. In these three countries, what happens is, first of all, you need to have a legal status to be a resident in that country or to work in that country. So for me, in New Zealand, I initially had a work permit because I worked as head of faculty for an Ayurvedic department. But then later I got my permanent residence, and then I got my citizenship as well. But let's say, I know it's okay to kind of say why there are so many Ayurvedic doctors in the West is also because they come to the West because of family. Like they are married to somebody who already is working here, or they have they have their families maybe in the US and UK, New Zealand or Australia. So they have legal status able to work in. I mean, a lot of my colleagues, unlike me, who to New Zealand because of my Ayurvedic qualifications, many of my colleagues would have come to the West because they got married to somebody, and they ended up here in the UK or New Zealand. And then what do? You have all these amazing skills, you have these qualifications, and can I practice Ayurveda? Yes, you can. You can. So the first thing is to look at a professional regulatory body. So in the UK, the professional regulatory body is the Ayurvedic Professionals Association, APA. So if you go and type www.apa.co.uk, then it will take you to the Ayurvedic Professionals Association in the UK. And there you have two categories. One is you are either a practitioner, which you will be completely eligible for, or you are a therapist. So a practitioner, like if you have a Bachelor of Ayurvedic Medicine and Surgery or MD/MS qualification, then you qualify to register as a practitioner from these voluntarily regulated professional bodies. APA is one such body. There are other professional bodies, such as BAP, which is the British Accredited Ayurvedic Practitioners Association. So you can become members of one of these organizations, and once you become a member of these organizations, that will allow you to apply for a professional indemnity insurance, because you need insurance to practice, because you're going to be in private practice. So because of that, you can apply for a professional indemnity insurance. There are many insurance companies that would allow you to to get the license or insurance, and I use holistic insurance in the UK. Say, I'm just getting some requests that bring them on camera, so let me just do that. I don't know them or who have asked to be added. Okay, so back to where we were. So you need to have a legal status to work or live. Secondly, you need to be a member of a professional association. So in New Zealand, in Australia, and also in the UK, there are professional associations that recognize Ayurvedic practice. You need to have your insurance. So this insurance will give you a good coverage should there be any thing that would go wrong in the practice. So it gives you that legal protection. So these are the basics. Okay, so basically you can practice. What about research? I'll come back to the practice. I'm going to talk to you about what can you practice, what can't you practice. But let's also look at the academic pathway. Academic expensive. As you can understand, if somebody is coming, let's say from India, Sri Lanka, and then wants to do a postgraduate study in the UK or New Zealand or Australia, it's expensive, but it's worth it. Luckily, in my situation, I got complete scholarship for all my postgraduate degrees. Like I was given the Australian Postgraduate Award. I had the University of Newcastle Postgraduate Award, so which covered all my course costs. It also covered my living costs. So I was lucky, and you could be one of those lucky people. So how can you then make sure or try that you do get your scholarships, you do get funded for doing your research? That depends on your talent. That's where your passion comes in. That's where how genuinely you are interested in contributing to the health of this country by utilizing Ayurveda. Because the future and also the present form of healthcare is integrative medicine. So here I'd like to stress upon something, the difference that really each one of us have to understand between practicing Ayurveda or teaching or researching Ayurveda in India to practicing or doing research outside of India. India has what we call a parallel healthcare system. A parallel healthcare system means that all the Ayush systems and the conventional medical system, one can go and a patient can go and see a conventional medical doctor or an Ayurvedic doctor. They can choose which kind of care they want, and it's completely legal to seek either conventional medicine or Ayurvedic medicine or any of the other Ayush systems. So all these systems like conventional system of medicine, Ayurveda, Yoga, Siddha, Unani, naturopathy, they are all recognized systems of medicine in India, whereas in the West, it is not so. In the West, we call it universal healthcare system. So there's a difference between parallel healthcare system and universal healthcare system. In universal healthcare system, there is only one form of healthcare, which is evidence-based medicine. So, which largely happens to be conventional medicine. So anything which sits outside of conventional medicine would be considered complementary or alternative medicine. So when it comes to research, that's slightly different. See, research has a greater interest in traditional, complementary, and alternative medicine because Ayurveda is a traditional system of medicine. Traditional system of medicine from India. And when you do research, yes, of course, you can engage with Ayurveda from a very Indian perspective too. But when it comes to practice, we all must understand that if you are practicing in the UK, Australia, or New Zealand, Ayurveda is an complementary or alternative system of healthcare. And also, I'd like to emphasize the difference between using something as medicine and using something for healthcare. We probably contribute more towards healthcare because we can use Ayurveda to complement, to supplement what conventional care probably lacks. See, in conventional care, usually it is diagnosis and then there is treatment. Generally, in chronic illnesses, it is medications. So patients are put on lifelong medications, and I'm sure you know this is true in India too, right? Like if someone is diagnosed with diabetes, or if someone has dyslipidemia, then they would be given an anti-diabetic or a lipid blocker, or like statin, and they would be told that they have to be on this medication for the rest of their life. So this, you think about it, this is only one way of solving the problem. Actually, it's not solving the problem. It's treating symptoms or suppressing the symptoms, but it's not really treating the mechanism. This is where Ayurveda can help. So those patients who actually understand this, because a lot of patients in the West who do seek Ayurveda are educated people. So they are interested in looking at in what ways can I manage my health without needing conventional medications or without needing unnecessary conventional medication. So when it comes to uh, this, you then would have to kind of look at not using Ayurveda as an alternative to conventional medicine. Instead of giving this person metformin or any other anti-diabetic, if you come up with another uh, anti-diabetic herb or herbal formulation, um, and prescribe that or recommend that to your patient, then literally it is just alternating conventional medicine with an Ayurvedic medicine. This is truly not the practice of Ayurveda, because in Ayurveda, the true practice is you have to treat the cause. You have to do samprapti vigatana. You have to go back to where did this disease arise from. So when we do that, there you have to go to someone's nutrition, their lifestyle. And this is where Shodhana, detoxification, panchakarma, and rejuvenation, they all will be very helpful. So it's very important for those who are stepping out of India to practice Ayurveda, know that, you are going to utilize Ayurveda to reverse modifiable disease factors, to treat the causes. You're not just using it as another alternative to conventional medicine. So this is something, very essential to know if you want to be a successful practitioner in the West. And also, our practice is very interesting. Like my clinic is on 57 Wimpole Street, which is in central London. It has an interesting interesting history, because that's where, you may remember Beatles. They were one of the biggest bands in the UK, and also, worldwide, and they used to live in that building. So it's a fantastic address to work from, to be honest. And in my practice, what I actually see is that my patients really want to understand what are the causes for their condition. Well, why do they have PCOS? Why are they having, say, an autoimmune condition like rheumatoid arthritis? And why do they have this constant digestive dysfunction? And then I would actually go back and try and understand the causes of it. Is really is education, is educating them about food, educating them about lifestyle, and so it is not possible just to superimpose the Ayurvedic training and Ayurvedic practice in India onto the West. That's not possible. So you would really have to be ready to learn how can we apply Ayurveda into a Western context. This becomes very, very important. Let me also, look at the research part or the academic pathway. So if you're a BA MS graduate, I would definitely encourage that you do your post-graduation. If you're a BAMS graduate and you end up in the West because you have a family, then you can start practicing the studies. But if you don't have a legal status to be in the West and you only have BAMS, it is possible, but it's a little bit difficult to do further studies. But if you already have a postgraduate degree in Ayurveda, then it's more helpful, because your career pathways are either in health sciences or in public health. So I started doing a master's in health sciences first, because I didn't know about the option of public health then. But then later I realized, if I really want to uh, use Ayurveda for the benefit of New Zealand community, then I am better off actually taking Ayurvedic principles of eating, Ayurvedic principles of nutrition, and then um, reducing risk factors for diabetes. And when I thought about it, the best way to do that is to do a master's in public health. So I changed from my master's in health sciences halfway through to master's in public health. So this is also possible. Start with master's in health sciences or master's in public health, or maybe a research master's in health sciences. And then, whether to which field to shift to. For me, it was public health. Okay. And in public health, there's a need. There is a need because, see, there's antimicrobial resistance, as most of you who are Ayurvedic graduates or studying, that there is this huge problem with unnecessary and excessive usage of antibiotics, and that has resulted in microbial resistance. And so in this Uh, our classics can help a lot because a knowledge of Sanskrit, a knowledge of the classical textbooks. Because when I first applied for my research fellowship at the University of Southampton, um, I met with Professor George Lewitt, who is a conventional medical doctor who has contributed a lot to complementary and integrative medicine. Unfortunately, he's dead. But in my interview, one of the things that he told me is, nobody in the Faculty of Medicine actually can read Sanskrit, interpret Sanskrit, and be able to translate these ancient textbooks which have so much wisdom, which can be utilized in research. So something I tell you is learn Sanskrit well. Learn to interpret classics very well. Try and understand the concepts of classics and see how they can be helpful for our current day health issues, not just in India, but globally and internationally. And that can actually become a very interesting topic of research for you, whether you're choosing a master's in public health or even PhD. What I would say is, uh, if you have a master's already, you can apply for a PhD. And I know that a couple of my friends, a few years ago, they applied for a PhD at the University of Technology, Sydney. They got admitted because, this couple, they had already published papers. And, when you have a history of publication, then you are likely to be accepted for a PhD along with your degree. So don't stop publishing, do good research, publish, and your publication is your passport to PhD, to put it in very simple ways. And with these two couple, they got the admission, but unfortunately, they couldn't get the scholarship at the time that they got admission. If they had enough funds to cover for about a semester, then during that time they could have come to the faculty, they could have really done good work, work hard, and then apply for scholarship, and they could have carried on. So always don't think that if you don't have a scholarship right at the beginning, then you can't. You can. If you can plan for about, let's say, a semester or a year of funding, during that time, be a good researcher, and your professors, your supervisors might really become very excited about your idea of research, and you could get a scholarship. I got my scholarship. I'm very thankful for that because it would have been not easy for me to complete my PhD if I didn't have that scholarship. And it gave me a lot of research experience, gave me publication experience. Something I would also say is that if you're thinking about research in Ayurveda, just don't go by what generally in our MD and MS we are expected to do. Cell line studies, we are expected to do laboratory studies, we are expected to do clinical trials, which obviously are not too large. Like when you're doing a clinical trial with a few patients, if it is not truly a randomized control trial, even if you put so much effort, if that can't be published, then almost it is like not a real research. So what I would say is you'd want to do a clinical trial during your postgraduate degree, then register your clinical trial, do it properly and publish it, because then that becomes fantastic, but not just as an exercise to pass the exam. Also, I would say learn qualitative research methods as well. One of my weaknesses at the very beginning was I only knew clinical trials, and that too not very well. I did my uh, clinical trial in the cancer of the cervix, stage 3B at Kidwai Institute of Oncology. Some of you might know in Bangalore, which was exciting because I learned a lot. But I didn't have good knowledge of research methods. Because, like at the time, we were actually utilizing methodologists who had knowledge of research methods, and we were mostly physicians, right? Yeah, we would come up with Ayurvedic um plan, and we would give the treatment. In my case, I did Deepana, Pachana, Snehapana, Abhyanga, Svedana. Then I used Shamana Aushadas and also Sthanika Chikitsa in cancer of the cervix, which is fantastic, as a treatment protocol. But if I had the knowledge that I have now, I would have chosen a whole system research method. So it's very important that we keep abreast of whole system research methods, mixed methods, qualitative research methods. For me, the biggest shift was during my MPH to think outside of clinical trial methods, to learn qualitative research. So hence I wanted to understand anthropology, ethnography. So I actually attended 6 months of MA at the University of Auckland, who was studying sociology. So I was sitting in sociology lectures and discussions because I wanted to use ethnography. So for me, it was a huge shift from moving from a clinical trial mindset to doing qualitative research. And so it's very important that you are passionate about being current, being able to learn what is necessary. Where can we take Ayurveda? Because Ayurveda is not just clinical medicine, as we all know. It's about lifestyle. It's about nutrition. It's holistic. It's really looking at all dimensions of what contributes to health. So therefore, we must use research methods which are also going to help us in being able to articulate or investigate, test those aspects. So to give examples of which are the colleges where you probably can look at, if you are interested in research and taking an academic pathway. Obviously, for me, I would say look at University of Technology, Sydney. There is a department called ARCIM, which is the Australian Research Centre in Complementary and Integrative Medicine. I'm a research fellow there, and there are fantastic researchers. They have published a lot, and they're very keen on traditional and complementary and alternative medicine, TCAM. So you could look it up. Sydney, Australia is a great place. Yeah, great place to live, great place to study. New Zealand, University of Auckland. University of Auckland has a very high ranking, and the School of Population Health is another great place to learn, to do your research. Is a great place. In the UK, you could look at University of Southampton. You can look at Imperial College, uh, who have a very fantastic uh, public health department. It's a very prestigious college as well. Antwerp in Brussels, an excellent university for doing public health. So really, if you're passionate, there are lots of opportunity. You need to be talking. You need to talk about, okay, this is my interest. This is what I want to do. Instead of next time messaging me or anyone else who is in the West, oh, is there a job opportunity? How is the scope for Ayurveda? There is no scope for Ayurveda. There is scope for you. There is no job opportunity, but you can create one. So think of it. If you're very passionate, if you really want to show to the world that there is a place for Ayurveda, because we can't just be managing everything through symptom management or symptom suppression, whether it is evidence based, even if it is evidence based, we are not going to be able to create health. We are not going to be able to change our communities. We are not going to be able to empower people to take responsibility for their individual health. So it's very important. Ultimately, besides your qualification and your skills, your personality matters. and I must really say that, you need to be a good communicator. I'm not saying good communicator as in you must be speaking very good English. Uh, we all learn languages based on where we live for some time. But a good communicator has clarity of their thought. They have clarity in conveying what they want to do with, and they have the interest to convey to the other person what they are thinking about, and other people's understanding, their feedback is important. So, uh, you know, for all young Ayurvedic doctors, I would say that, uh, go beyond Ayurveda and think of health issues in general. Think of where Ayurveda as a model can help uh, answer the health issues that we are facing today globally, and then see where you can do research. And even when it comes to practice, your communication is very important. So, unlike, I'll tell you this example. I worked in a very remote village in India after during my MS. And it is a place that's like kind of had no public transportation. You really had to like take 3 or 4 different modes of transport and ultimately end up in a big van which had men, women, goats, and chicken and me. And then I would get off on the highway and walk for about 2 kilometers and get to the dispensary. And interestingly, these villages, they would just ask me when I say, okay, why are you here? They would say, you are the doctor, you tell me. You are the one who has studied, so you tell me why I'm here. So, I mean, in the sense, from there, and then they would also say, okay, I just want some medicine. But that's a very different setup. See, in the West, you would need to educate your patients. You would need to really tell them why you're asking them to get up at, let's say, 5:30 or 6 in the morning. Why are you asking them to have hot water instead of cold water? Why are you asking them to have, let's say, dal or khichdi during the preparatory phase of Panchakama? You can't say because that's what is said in Ayurveda. You can't say that's what Acharyas have told. That's what Charaka has told. Because for them, they don't know. They don't have the same understanding of Aptopadesha. So you would need to explain to them the rationale behind it. So you would need to think, why? Why would you have to restrict calories? Why would you have to, do langana? What are the medical benefits of skipping meals or reducing calories or not having rich food, which are highly inflammatory? So you would have to come up with a language of communication that actually convinces the other person that they understand Ayurveda the way you understand. Let me give you an example. See, for instance, for me as well, when it comes to using technology, I'm capable of using technology if it is explained to me properly. So, but if they start talking about technology, like an IT person, in their technical language, saying that, this is JavaScript, this is HTML, like your VPN is not right, then I would get confused. In a very similar way, if you and I start to talk to our patients in the West saying that, this is what Charaka said, this is what Sushruta has told in Sharirasthana or Vimanasthana, or this is what Ayurveda says, it would be like talking jargon to them. So you would have to translate that not just in language, but also as a concept. So this is a skill that you would need to learn constantly throughout your life, or to be able to communicate your ideas in a way that is very simple, that they can understand. I think, ultimately it's your personality, it is your passion, it is your determination to be able to apply Ayurveda in any environment that can give you opportunities, because people will recognize that when you have that passion, they'll recognize, they'll say, yeah, okay, oh, this person is really interested, this person actually is talking sense, so uh, let's learn from this person, or let's see this person as a practitioner, or let's do research with this person. So your personal attributes are very, very important besides your qualifications. So I think uh, challenges the challenges, or there are regulatory challenges. So if you're practicing Ayurveda in the UK, let's say, or even in New Zealand, so there are certain regulatory acts. So in the UK, we have what is called uh, Traditional Medicine and Herbal Products Directive, THMPD. So you would have to become familiar with that. So THMPD, according to that, as an Ayurvedic practitioner, you can dispense a herb or a set of herbs to your patient, but you can't sell it like over the counter. It has to be because you have done a consultation and you're dispensing. And there's a difference between patients who go online on Amazon and buy products. That's different. That they can do. They have that choice. But you, as a practitioner, you are responsible for what you give to your patient, and so you would have to learn that. And multiple formulations or classic formulations are not easily available, and purely because they are not legal. See, unless compound formulation is registered, you can't use it. And in the West, herbal formulations are not medicines; they are nutritional supplement. They're food. So you also need to be realistic in thinking that actually you are going to use this mostly as nutritional supplements, not in the same context as in India, where we use it as medicine. Panchakarma. I mean, let me go talk about Panchakarma a little bit later, but when it comes to herbs again, it's not just Ayurvedic herbs. I mean, of course, you can't use Rasa Avshadas. No way. I mean, because yeah, you can't. Legally, it's not allowed, and um, yeah, even if it is effective for the patients, no, because unless you are working in a research organization where you are trying out something, that's but not in practice. Uh, and when it comes to Panchakarma, yeah, again, in the UK, Vamana is not legal because it's not legal. Whereas Virechana is, Basti is, Nasya is. So you can practice Virechana, Basti, Nasya, all the Bahya treatments like Abhyanga, Shirodhara, Katibasti, all of that can be utilized. When it comes to herbs, you also would have to um, consider a website called Citus. Okay, Citus lists all the endangered and banned herbs. For instance, Vacha, Acorus calamus, is banned in New Zealand, also in the US. Although it's kind of, we think it's a harmless herb in India, it is banned in uh, New Zealand. Australia has Therapeutic Goods Act, which is not there in New Zealand. So there are differences. So whichever the country where you want to practice or you want to do research, you would need to do a lot of reading about the regulations and be familiar with the regulations and respect those regulations so that you don't make any mistakes. So CITES is a very important website to look at. And so I think, uh, overall, I would say that yes, of course, BMS is a fantastic degree, and so MD and MS, but it comes down to how you want to apply. it is not quite like how I was thinking. When I thought, okay, when I did my BMS, I was advised, oh yeah, you have to do your MD because if you don't do your MD, you won't get a job. Of course, I was very young, right? And I was impressionable, and I would take advice of others. I mean, with due respect, if somebody is more experienced, why would you not take that advice? I did. And I did my, but the reality is actually, you don't need a MD, you don't need a MS. You need BMS, for sure you need BMS. But what you need is not just the qualification, not just the skills, but the passion. And once you have that passion and your ability to learn the culture, your ability to learn the health systems, your ability to keep up with research, your ability to reinvent yourself, to adapt. One of the key aspects of Ayurveda is really to adapt, right? That's what we do. We adapt, adapt, and adapt to become healthy. Even to become successful as practitioners or researchers, we need to adapt to the circumstances, to the current realities. And that's what I would say is very important. So don't think about just whether your qualification is recognized or not. In most places, it is. But you can't practice the way you practice in India. It is not recognized in the same way. There are legal restrictions, there are legal regulations, but even within all of this, if you are very passionate to contribute towards people's health, yes, Ayurveda is fantastic. I think it's going to become even more popular, especially after this COVID, because now, like we have lost this perspective. What we thought always works well, we don't know. We no longer understand what contributes to health. Therefore, people are looking for, can we take individual responsibility for health and can Ayurveda help? So I'm sure, because of this COVID, it has changed the way we think. It has changed the way we see the world. We think about systems and health. So both for practice as well as for research, there will be there will be there'll be increased opportunities. Should we have the interest and ability to stand up to those challenges or embrace those opportunities and then to start to apply Ayurveda. So I think I've spoken a lot. If there are any, I hope it was helpful for you. But do go to my website or make a note of my email address. It's hello, HELLO, at murthyclinic.com, HELLO at murthyclinic.com. And I would be willing to share any relevant information. Or go to my website, www.murthyclinic.com, murthyclinic.com, and you'll find more information. Or go to ayurvave.com, ayuwave.com, and you can find more information about my work, and you can follow me, contact me. I'm always happy to help, especially young graduates. But just don't ask me, oh, is there a job opportunity? Is there scope? Because there's no such thing like that. These are very vague questions. You have to be very specific. This is my area. This is my experience. This is what I want. Then possibly anybody, not just me, anybody who has lived in the West or who's been using Ayurveda in the practice or in the research will be able to help. And I wish you all the very best. It's a great system to utilize Ayurveda, and I hope, more and more people are able to actually bring Ayurveda to the West, or aspects of Ayurveda to the West, because it's universal. It's a universal system. So I think I'm happy to take some questions if there are any questions or if there are any comments. So I'm just going to go by what is visible now because I was talking. So if I have missed any of the previous ones, do let me know. I'll see if I can answer them. For academic interested person, can they practice Ayurveda in clinics as it is BMS, MSc, anatomy? Yes, yeah, you can. You can practice Ayurveda. In the UK, you can become an Ayurvedic practitioner and then you can practice Ayurveda. Yes. Let me see if there are any other questions or comments. Let me go to any of the previous questions. What's the scope of BMS, MSc, biotechnology, microbiology? Yeah, it's a very good area. It's a very, very good area. Definitely, I would say. I'm not sure if there are other questions, but let me just go to. All right, okay. So, Dr. Sapna Sapna Shaha is asking, oh, again, we have to opt for their system of education? No, you don't need. You don't need to opt for their system of education. It's always good to have an additional Western qualification because it kind of makes us familiar with Western ways of thinking. What's the gross regulation and requirements to practice in UK as Ayurveda practitioner? So the regulations are, as I told at the beginning, so you would have to register with the Ayurvedic Professionals Association or any other regulatory body by providing your certificate and your legal status to live in the UK, and then you have to get your professional indemnity insurance, and then you can start practicing. Yeah. Okay. Thank you, Dr. Sapna. She says, yeah, it was a good session. Thank you. And yeah, and if there are no more questions, I think let me make the concluding remarks and then this I've been told by the organizers that will be available to view even afterwards. So I'll go through the comments and try and answer. Can we come and practice as a visiting faculty for a clinic? No, that's not possible. To practice as a visiting faculty, you would need work permit. Legally, you would need work permit to be practicing in the UK or the West. Uh, so the answer would be no. Dr. Vivek is asking, is this necessary to do higher study from UK to get good representation in the UK? Not necessarily. You know, you can, I didn't do any higher studies in the UK. My higher studies are from New Zealand and Australia. Uh, no, it is not necessary that you need to do a higher study in the UK. It's mostly in the discipline, you know, like I sometimes think that, you know, if you're looking at public health, you are better off doing a master's in public health or a PhD from a reputed university in India. I think there are some in Mumbai. And if your research is good, yeah, you know, it's totally fine. It doesn't matter whether you study in these disciplines in India or elsewhere. Okay, so it's nearly 60 minutes. That's a long time for anybody to pay attention to. And thank you so much, you know, for joining me. And thank you, organizers of Tadvidya Sambhasha Parishat, for giving me this opportunities. I still remember, you know, one of the favorite chapters for me in Charaka was Tadvidya, when Charaka describes Tadvidya Sambhasha, is that we actually can only become better by critical thinking. You know, it's so interesting that in Ayurveda, there is such an emphasis about not just following, but actually thinking critically. And by critical thinking, then applying. So this Tadvidya Sambhasha is very important in applying Ayurveda. So thank you, Dr. Vivek. I'm glad, it was helpful. Yeah, do stay in touch. And yeah, if you have specific questions, I will try and answer. Yeah, when it is possible, I'll try and answer. And I wish you all the very best. Yeah, thank you very much. And I'm going to disconnect now and have a lovely evening if you're watching from India. If you're watching from the UK, have a lovely afternoon. Take care. Bye bye.